is Sallstrom, and I'm here today to talk to you guys about quitting smoking. Now imagine that you're getting ready to go for a jog, and you tie your shoes and you get down the road, and you're breathing nicely. Not as good as you should be, but you're breathing better. And why is this? Because 2 months ago, you were a pack-a-day cigarette smoker. When you quit smoking, you feel better. I'm going to go through some health risks and diseases that smoking causes. I'm going to explain to you why you should quit smoking. And I'm going to tell you about some effective ways to help you quit smoking so that you can live a healthier and better lifestyle for you and your family. Cigarettes damage your health. They contain thousands of chemicals in them. One cigarette contains thousands of chemicals. Those chemicals include cadmium, which is found in batteries, nicotine, which is found in pesticides. There are ammonia in it as well. There are methanol, which is rocket fuel, carbon monoxide, which is exhaust fumes, arsenic, which is poison, methane, which is sewer gas. Now I've just barely touched on the list of things and chemicals that are in cigarettes. You wouldn't go into the kitchen and grab a bottle of ammonia and drink it. No. Why is that? Because you know that ammonia is toxic and it is a poison. Every time you light up a cigarette, you inhale ammonia. Maybe you don't consciously realize this, but you are allowing a dangerous chemical and dangerous poisons into your body every time you light one cigarette and smoke it. Other health risks associated with cigarettes and other things that damage your health associated with cigarettes. As everybody knows, lung cancer. Smoking affects your lungs. This here is a healthy lung. That is a lung damaged by smoking. Along with the risk factors to your lungs, you are making risk factors for your throat, which you can see here, there's cancer in the throat, there's a tumor, and for your mouth, which as you can see there is a lesion inside of the mouth that is probably mouth cancer. You don't want these things. Most people don't realize that other things associated with smoking are mouth cancer, throat cancer, and lung cancer. Smoking kills. It is deadly. Why you should quit smoking? Well, high blood pressure is associated with smoking. High blood pressure is a sign that the heart and the blood vessels are being overworked and are working too much. High blood pressure ultimately causes heart disease. Heart disease damages the tissue in your lungs, decreases the amount of oxygen you have in your blood. It increases your heart rate, and it increases your blood pressure, which ultimately leads to a heart attack. None of you want a heart attack. Along with high blood pressure and heart disease is emphysema. Emphysema is weakened and collapsed air sacs filled with mucus in your lungs. You are not able to breathe properly. You are shortness of breath. You have high blood pressure. You have heart disease. Emphysema will kill you. Most people that have emphysema are put on 100% pure oxygen because they cannot get enough oxygen from the air to survive and to keep them breathing. Now, along with those three things, again, there's lung cancer. 1.3 million people a year are diagnosed with lung cancer from smoking. None of you want to be one of those of the 1.3 million people. Lung cancer is horrible. Pain, discomfort, and it's just horrible. High blood pressure, heart disease, emphysema, and cancer are all associated with cigarette smoking. Another reason why you should quit smoking: the people and your children around you. One cigarette and the secondhand smoke from one cigarette distributes over 4,000 chemicals. 200 of those chemicals being poisonous, and 40 of those chemicals being carcinogens. You don't want to expose your children or other people to your secondhand smoke. Children affected by secondhand smoke have an increased level of bronchitis, have an increased level of pneumonia, have an increased level of upper and lower respiratory tract infections, asthma, wheezing, coughing, and the list goes on. You don't want to be responsible for your children's health, as far as them being sick all of the time because of your smoking. So now I know some of you are looking at me. Well, I go out and I smoke on the back porch when my kids aren't around, and I make sure that they're not around. Okay. Well, when you're out there smoking, that smoke settles on your clothes. And having that smoke settle on your clothes, and you come back in, those poisons, those carcinogens, and those chemicals are still on your clothes. You can still smell that cigarette smoke. You are still exposing your children and the others around you to that secondhand smoke, even though you're not light up right next to them. Another reason why you should quit smoking: smoking decreases your ability to exercise. With no exercise, you are not living a healthy lifestyle. Smoking decreases the ability for your lungs to get enough oxygen in them to make you feel comfortable when you exercise. You need a certain amount of oxygen in your bloodstream when you exercise so that you feel good about it. Smoking decreases that amount of oxygen. It makes shortness of breath, sweating, fatigue. Most people that smoke don't think that going out and exercising is worth the feeling that they get when they exercise, because they feel so horrible. 24 hours after you quit smoking, the oxygen level in your blood has increased dramatically. You have now allowed your blood to get a reasonable amount of oxygen. Yes, you might not be able to go out and run a 5-mile marathon, but you will noticeably feel better and be able to exercise and gradually get into a routine if you quit smoking. Now, some effective ways to quit smoking. There are many ways to quit smoking, and I'm only going to touch on a few here. There's Nicorette gum. Nicorette gum, you chew a piece, and it gets rid of that craving because it's subsiding the nicotine receptors in your brain. They are no longer craving the nicotine, which is what your body ultimately becomes addicted to when you're a smoker. As you chew the Nicorette gum, as the days and the weeks and the months pass, you're going to gradually back off of how much you're chewing, and before you know it, the nicotine receptors in your brain are no longer craving the nicotine. You want your receptors in your brain to not crave the nicotine, and Nicorette gum is a good one for it. Another medication prescribed by a doctor that will help you quit smoking is called Chantix. Chantix is a pill. You take this pill every morning. The dosing may be different for other people. And what that does is, after the Chantix is released into your bloodstream, it attaches to the nicotine receptors in your brain and does not allow nicotine to get to those nicotine receptors. Therefore, the decrease in nicotine is a good thing. Your body does not crave the nicotine as much. Now, you're not going to take the pill and wake up the next morning and be a non-smoker. It's going to take a while. But 44% of people that take Chantix quit within 9 to 12 weeks of taking it. That is pretty darn good results for a drug to help you quit smoking. If you think about it in the big scheme of things, 44% of 1.3 million people that get lung cancer is a lot of people that will not get lung cancer because they have quit smoking. Wellbutrin is another drug used medically to treat smokers. Wellbutrin is an antidepressant, but Wellbutrin also blocks nicotine receptors in your brain and allows your body to slowly adjust to not having as much nicotine as you need. Now, along with medications, there are other ways of quitting smoking that are effective. Hypnosis is another way to quit smoking effectively. 66% of people that try hypnosis quit smoking. Hypnosis puts you into a state of relaxation, allows your conscious to not take over your subconscious. Your subconscious is where a lot of your stress, your depression, your anxiety, and all of that lay. And it is proven that people that smoke have depression, anxiety, and a lot of stress in their life. Hypnosis will allow you to deal with those stresses while not having the nicotine and while not having the other stuff, the other chemicals. You want to try to quit smoking. And 66% of people that try hypnosis quit smoking. That's a very high number of people that quit smoking due to hypnosis. Now here are some websites for you guys to go on and look. These are support groups for non-smokers and for people that have quit smoking or that want to quit smoking. There's a website on here that goes further into depth about the diseases and the health risks that smoking causes. There are a lot of programs and a lot of ways for you guys to stop smoking. In order to live a healthier lifestyle and to be healthier for you and to be healthier for your children and the people around you, you need to quit smoking. Smoking will kill you. Again, the main goal in all of this is wanting to be healthier. With no more cigarettes, you feel better, you are more apt to exercise, you don't have as high of risk of getting lung cancer, mouth cancer, throat cancer. I've given you guys reasons why you should quit smoking, your children and the other people around you. I've also given you guys effective ways to quit smoking. These are proven ways to quit smoking. You want to quit smoking so that you can have a healthier lifestyle. Thank you all for listening, and I hope that all of you go on to these websites that I had listed here and look up some of the information and that you guys quit smoking. Thank you very much and have a wonderful day.